Dr. Jere here with Mills Chiropractic and Wellness Center. I wanted to wrap up our series on low back care this month, talking about some of the common treatment approaches for low back problems, and kind of looking back through history just a little bit as we do that. You know, I hate to sound old, but I've been at this for almost 20 years, which is still mind-boggling to me when I think about how fast things have gone, but also how much has changed through the years. But unfortunately, a lot of times we're still using, as patients, we're still using old knowledge, right, and old ways of doing things. And so, and when it comes to the treatment of low back, sometimes even some of the best doctors are still using some of the old information. Although NSAIDs, ibuprofen, Advil, Aleve, these non-steroidal anti-inflammatories, they can still be purchased over the counter. That doesn't mean that they don't have risk. And, over the last 20 years, we've really seen the effects of low back pain and how it's changed the landscape of healthcare forever. It's estimated that NSAIDs cause over 100,000 hospitalizations every single year. And then we went through an evolution where we were using opioids as a treatment for low back pain. And still, we're coming down, and the numbers are coming down, but there's still over 100 people that die every single day from opioid overdoses from properly prescribed medications. And that is just mind-boggling, and it's heartbreaking because there's so many other options. In fact, a couple of years ago, right before the whole COVID craziness, there was a big task force put together, and they published their results in the Lancet, which is one of the highest level of journals out there. It's actually a medical journal, and they looked at low back pain and looked at all the different treatment approaches. And the summary of this 5-part series, it was an extensive research project, and it actually was published in 3 separate parts. But one of the things that they came out of that suggesting is that we really do need to do away with using medicine as a first line treatment, because it never fixes the problem, right? It just covers up the symptoms while patients often continue to deteriorate. What their big finding is we really do need to push movement therapy, which is what as chiropractors we've always been doing, right? And so it's just kind of fun to kind of see the whole evolution as we kind of move into and science embraces kind of what we do. So anyway, if you have short-term or low back pain, maybe for a day or two, an NSAID is okay. But it really should not be a first-line treatment. We talked at the beginning of the month how important movement is and proper movement. And that is really the heart of chiropractic care. And so if you know somebody suffering with low back pain, before they start sliding down the slippery slope from using Advil and ibuprofen to higher levels of medication all the way up to opioids and surgeries and injections and things like that, just as a reminder, start with what the research supports: movement-based therapies, chiropractic care being at the top of that list. So anyway, I hope you got something from today. I look forward to starting a new series next month. I hope you're enjoying these videos. Stay healthy, stay well.